Well, as promised, we continue our look at pregnancy and safe delivery in lockdown. Joining us again is consultant obstetrician and gynecologist Dr. Andrea Griffith-Bowe. Dr. Bowe, again, welcome back.
Good morning.
Well, today let's take a look at what the maternal and child health care teams are doing to ensure the continuity of care for pregnant women.
Well, we don't want to interrupt the care that we deliver to our pregnant women, but we do realize that we're in a national emergency. And so what we don't want is to have crowded antenatal clinics. Certainly, we had a scenario yesterday when we had over 60 individuals attend an antenatal clinic, and indeed it will be very difficult to ensure adequate social distancing in these scenarios. So what we have done is that we're only seeing at this point those patients that are designated high risk, or ladies that are 36 weeks, 37 weeks, 38 weeks, 39 weeks, and 40 weeks pregnant. All other patients should remain indoors at home and wait for a call from their clinic for their clinic appointment reschedule.
That's on the clinic side. What's being done, precautionary measures that is, at the Princess Margaret Hospital for women coming into the maternity wards?
Excellent question. So we have worked really, really hard to make the experience at Princess Margaret Hospital comfortable but safe for our patients. So maternity patients would note that as they enter the institution, that they will have to be answering a few questions as it relates to COVID symptoms. They will also have their temperature check done before they can be allowed on any of our units. It seems a bit extreme, but we want all of our patients and our staff to be safe. If an individual has symptoms suspected of COVID and the questionnaire and the temperature suggests that they need to be screened, patients would immediately be provided with a mask and taken to an isolation area where they would be kept away from other patients and staff members.
Are there any concerns for Family Island pregnant mothers coming in from the Family Islands?
Absolutely. So we've spoken to the midwifery staff in the Family Islands, and so we have an idea of the numbers of pregnant ladies who are at term. Meaning, when we say at term, we're talking about from 36 weeks and beyond. And so we've been asking these young ladies if they can get out of the Family Island, because as we are aware, it's difficult to get emergency flights out. And for the most part, ladies have been compliant. We do know that we have about 5 individuals at term left in Hatchet Bay. We have about 3 in Lower Bogue, and we have about 2 in Mangrove Key. And so we are working really, really hard at getting these patients out, because it will be very difficult to address an obstetric emergency in this current pandemic scenario.
Any backup measures just in the event these women are unable to get to the capital?
Well, we've spoken to the midwifery staff in these clinics, and we're asking them to be prepared in the event that they may need to do a delivery on the Family Island. But this is not the ideal scenario. So we're hoping and praying that we can get these 10 or so women out of these islands and either to Freeport or to Nassau.
Well, thank you so much, Dr. Griffith-Bowe, for joining us again here on the Morning Edition. Great advice there.